I'm Marganit. I'm going to be setting up the TENS unit. It comes in this little black book. My patient has continuous low back pain. It sort of crosses over the whole back. The pain's equal on both sides, so I'll be setting up the electrodes in a crisscross pattern. Before I do so, I'm going to have to check for contraindications. I'm going to make sure there's no possibility of her being pregnant. I'm not going to put it near a pacemaker. I'm not going to put it on if she has a pacemaker. I'm not going to put it near her carotid sinus or if she has a DVT. I'm going to be checking her skin to see if there's any open wounds, anything there, any infection. I'm going to be checking her sensation and mentation using a paper clip. So, you know, this is dull, this is sharp, and I'll be asking her what she feels. And then I'm also going to clean the area before I put on the electrodes. Okay, she's going to have a pillow under her abdomen and under her shins just to make sure she's comfortable. And then I'm going to place her electrodes on. I'm going to be putting one electrode above the pain, and then the electrode that will go over the corresponding channel within the same channel, crisscross below the area of pain. And then the same with the other two electrodes on the other side, so it's a crisscross pattern, and that the pain relief can go across the whole area. Okay. I've got two channels set up on my ESA machine, so I've got both wires plugged in. For channel 1, I'm going to plug in one of the wires here, and then the other one in the same channel, crossing over. Okay, and then I'm going to do the same thing for channel 2. I want to do pain relief, and I want to do an endogenous opiate pain release, so I'm going to be using a low rate TENS. On this machine, what I'm going to be doing is I'm going to be setting the pulse width. It can be anywhere between 100 to 300 microseconds. I'm going to set it to 150. The pulse rate can be anywhere between 2 to 10 pulse per second, and I'm going to set it at 4 pulses per second. Okay, once that's all set, then I can turn up the intensity. I'm going to tell the patient that which are these two buttons, one for each channel. I'm going to tell the patient that she should be feeling a slight sensory, or she should be feeling sensory, and then that should go to a motor contraction. Okay, I'm going to turn them up. I'm going to ask the patient, how are you feeling?
Good. I don't feel it yet.
Okay.
Okay, I feel it. I feel like a slight buzzing, like
Okay.
a tapping.
Okay. I'm just going to keep turning it up until I get a motor contraction.